Hello, I'm Nina Vassell. I'm a child psychiatrist working in the Department of Psychiatry at the University of Oxford. I'm here to present Elise Sellers, who has been leading on a piece of interesting work about what the educational mental health practitioners in schools have been doing during the initial lockdown period of April to June 2020. So I'd like to also thank the NIHR for funding this research through the Thames Valley in Oxford ARC. Thank you, Elise.
Okay, so we conducted a survey with school mental health practitioners. 88 took part, and the survey was about the kind of support that they have been providing to schools during lockdown and their thoughts around what future support as schools return should look like. So we asked them what have schools been in touch with them about, and the most common concerns were general mental health concerns of pupils, specific children's mental health needs, and discussing planning to schools, discussing the return of schools. So this meant that the kind of remote support provided was mainly one-to-one interventions, group sessions, workshops, teacher consultations, and providing school newsletters and information around mental health support for schools. We also asked them a little bit about their thoughts around working remotely, and the main themes that came out were issues around space for sessions. So the good things about providing support remotely were that some young people felt more comfortable speaking from home. Parents were more likely to be able to attend sessions. Practitioners could see more clients per day. And the things that weren't so good about providing remote support were that some young people struggled to find a confidential space to speak whilst at home. Not all young people also had access to the technology necessary to facilitate remote sessions. And also sometimes providing remote support was harder for young people with ASD or young people with other vulnerabilities. And then some issues also specific to BAME young people came out, such as worries around higher mortality rates from COVID-19 in the BAME community. And then thinking a bit about schools returning, EMHPs were worried about an increase in need in mental health support as schools returned, specifically around transitions, anxiety, so maybe separation anxiety, social anxiety, or just general anxiety returning to school, low mood and bereavement. And what they really felt was that whole school approaches to mental health, along with specific support for students, parents and teachers, was important. Some hopes and concerns as schools returned came out, such as capacity concerns and worrying whether they'll be able to see as many pupils as they have been able to during lockdown when they haven't had to travel between schools. Uncertainty around what working in schools will look like, and then a hope was maintaining the option of remote sessions as a way of increasing the accessibility of sessions. And then some concerns were safeguarding concerns around providing remote support and concerns around building therapeutic alliance if you're working with a new client remotely. But they did think it was important to keep some aspects of remote working, so particularly providing support remotely, remote Teams meetings, and having that flexibility with their timings of their work day so that they could provide support maybe after school for clients. And then finally, we looked a little bit about diversity of the survey respondents and around BAME young people. So 95% of survey respondents were white or white British and 95% were female. We asked respondents if they felt equipped to meet the needs of BAME students, and half said somewhat well, with only 27% feeling that they could meet the needs well and only 5% feeling they could meet them very well. Thoughts around what was needed in order to better meet the mental health needs of BAME students was training specifically focused on supporting these students, finding out from BAME communities what mental health support was needed, recognising specific challenges these groups of students face, and whole school education around how ethnicity, culture, and religion may impact perception of well-being. And then finally, some of the issues encountered specifically for students during lockdown were the cultural attitudes towards receiving mental health support, language barriers, less access to online platforms, and worries around the high mortality rate from COVID-19 and social distancing in overcrowded communities.
Well, thank you very much, Elise. The report in full is available online, and there'll be a link in this video that you can find that below. Thank you.